to order. And do we have anyone calling in?
We do not.
Okay. Can I entertain a motion to approve the minutes from the last meeting? Betty? Junior? Are there any additions or corrections to those minutes? All right, seeing none, all those in favor, please say aye.
Aye.
Opposed? Motion is carried. Okay, under our information items, we have the PCAPS monthly report. Becky? Are there questions?
I don't have anything to add today, but I will happy to entertain any questions.
Okay, thank you. Does anyone have questions? Okay, moving on to the workforce report. Are there questions about that or comments? All right, seeing none, we'll move on to the workers' compensation and liability report. Are there questions or comments about that? All right, moving along to the resolutions. We have two resolutions today, and they both come from PCAPS. And so, Becky, did you want to make a comment, or do you want us to put a motion on the floor first?
I do have a PowerPoint prepared for you today to give you some background information.
Okay, well, let me have a motion then. Okay, you'll make a motion? Yes. All right. Member Ricker made the motion, Member Duncan seconded, and this is a resolution regarding the Veterinary Medical Association agreement, which has been a pretty long-standing agreement. But yes, please give us your presentation, Becky.
All right, so you have before you a PowerPoint here in regards to veterinary services, and I just want to go through about 8 slides and give you some background and how we got to where we are today with the 2 resolutions before you. All right, so PCAPS has some statutory requirements for veterinary services. The licensed veterinarian must be appointed the deputy administrator, and that's per state statute under the Illinois Animal Control Act. And then per state statute under the Illinois Animal Welfare Act, all of the dogs and cats must be spayed or neutered before they go home. And those are procedures, of course, that only veterinarians can perform. In addition, we also have some other needs for veterinary services. We shelter about 4,000 animals a year, and of course at times they become ill or have injuries or need a rabies vaccine. All of those things are done by visiting veterinarians. We also host twice a year a low-cost rabies vaccine clinic for the community-owned animals. And we also host pretty regularly low-cost spay-neuter programs for community-owned animals in an effort to reduce some of the population, specifically with some emphasis on pit bulls and cats, that we have an abundance of those animals at the shelter. Those are our needs. So let's talk about the history. So since the inception of animal control with the county, as well as many years before, we have brought before you resolutions to approve the Peoria County Veterinary Medical Association to do this work. So their elected president became our deputy administrator. The spay-neuter surgeries were typically performed at the Tri-County Animal Emergency Center. We had visiting veterinarians, basically a different veterinarian every day comes down sometime around the lunch hour to take a look at the animals in the shelter based on the list that we've provided. We do low-cost rabies vaccination clinics, and then those low-cost spay-neuter programs all for community-owned animals using veterinarians that they assign us from the Peoria County Veterinary Medical Association. So that's been the history. And then the challenges with that arrangement, really as we've been through this relationship for years and years, the inability for the veterinarians to keep up with the surgery load has really been a lot. And as that's declined, for example, we used to see about 25 animals a week go off to the Tri-County Animal Emergency Center overnight. And recently, we're lucky to get about 15 animals a week spayed or neutered between the Tri-County Emergency Center and then other veterinary partners as a part of this agreement. We have reached out over the years pretty consistently. About every quarter, my team reaches out to community veterinarians that are a part of this Veterinary Medical Association, and we ask if there are folks that are willing to take on our spay-neuter surgeries. And pretty regularly, we're met with a no. So we have about 5 clinics that we're working with, and of those 5, including that Tri-County Emergency Center, we're lucky to get about 15 surgeries a week done, and our needs are far beyond that. And so because of that, the animals have an increased length of stay, and some of those other challenges that you see there on the screen. We're transporting to 5 different vets. We have accountability of 33 different veterinarians that are coming for our vet of the day, and many of them are doing our surgeries. And then our community publics are subject to their veterinarian availability, which has really decreased over time. And so as we have been faced with these challenges over the years, we've been seeking out other alternatives to this Veterinary Medical Association agreement with the PCVMA. And so let's take a look at the cost. So historically, our costs, there was a flat rate contract that went from about 2017 to about 2020. And really the only fluctuations was about a 3% increase in the administrator fees over a couple of years there. But what was really driving these ups and downs of the cost was the number of surgeries and animals that we had for surgery. And so if I were to overlay a graph on this one of the animal intake in the shelter, you'd notice it would follow a very similar pattern. Those dark blue bars in the bottom represent the number of animals that are adopted and needed surgery and we paid for in those years. That kind of royal blue in the middle were number of owned animals. So those are those community animal programs that we're spaying and neutering for members of the community. And then the administrator cost, so that deputy administrator role for animal control is that light gray bar on the top. And you'll see that didn't change very much. There were a couple of years with some 3% increases until we got to 2022. So when we went to negotiate the contract in 21, the Vet Association was asking for a pretty significant increase in their prices. The prices of the spay-neuter surgeries went up about 30% on average, and the prices of the administrator role went up about 10%. And they're looking for about a 10% increase again in 2023. And so that just gives you kind of the perspective on the cost and what's been driving that. And so, as we said, as we've been faced with those challenges as well as the increases, we've been looking for solutions, and we are excited to present one today. We are going after a partnership with a single veterinary practice for a solution to this. So we would have a contractual agreement that specifies the number of spay-neuter surgeries per week. That would get us to exactly where we need to be and solve a lot of the challenges that we've faced in the past. The surgeries would be performed on-site at PCAPs, and this satisfies all of our statutory requirements, and it meets all those needs that we talked about in the beginning for what we need to accomplish with veterinary relationships. And so the cost of this project is about $118,000, which puts us in less than the actual agreement would be with the Peoria County Veterinary Medical Association. This cost is exciting to me not only in the sense that it's less, but it's also exciting in the format that we would bill it. We would bill this cost quarterly as just one invoice. Currently, I have about 5 different animal hospitals billing me daily for surgeries, piece by piece. And so we have to reconcile all of those bills. Sometimes we have to hunt those bills down. It can be pretty time consuming, so the billing part of this is also very attractive to me as well, not just that the cost is less. And so the benefits of this arrangement would be that our deputy administrator would remain consistent. That position wouldn't change based on an election or really any reason that wouldn't change. Our surgeries would be performed in a timely manner because we have a contractual obligation for a number that we need to hit every week. That means we also then don't have to transport animals regularly to other practices. Some of the practices we're using now are about 15 miles away. So we're driving them in the morning and we're picking them up in the afternoon, and there's certainly a cost associated with that. Our animals can be adopted same day. If we have animals on our floor that are spayed and neutered and ready to go home, then adopters can come in and leave with an animal of choice. They don't have to wait. That also makes us a little bit more attractive to adopters as well. People want to take those animals home right away. Consistency of care is very attractive to me. Right now I have 33 veterinarians visiting the shelter, and many times they have different perspectives on treatment plan and medications that we should use and things of that nature. So paring that down would be very helpful for our operation, including accountability and billing, and then of course the cost. So all of those things that we've talked through, this would be a huge benefit to us and solve a lot of the challenges we faced over the years. So for 2023, what this looks like is we estimate January through June. We have before you the resolution for the Peoria County Veterinary Medical Association agreement. That is a one-year agreement as it's written, with I believe a 60-day notice to get out of the agreement should we then transition over to this other arrangement. And then in the other arrangement, the Brown Animal Hospital and Dr. Justin Brown would take on our administrator role. We have that agreement estimated between July and December. The reason for the estimation is it allows both parties to get some things together. We are working on securing either a mobile unit or a facility, some place to do the surgeries and start a surgical suite. And then, of course, to secure all of the equipment. And then Brown Animal Hospital needs to secure necessary staffing to bring with them to perform the surgeries and do this work. And I am happy to take any questions that
Okay.
may have inspired.
All right. Are there questions on the resolution to the first one, which is extension of the agreement with the Peoria County Veterinary Medical Association to provide veterinarian services and deputy administrator responsibilities to PCAP? Are there questions on that? Member Ricker.
Yeah, I just want to make sure I understand the duration. I think if the slide you have up here now would say, we'll sign a one-year contract with the ability to opt out of it at the end of June. Is that what I'm reading, or is there something I'm missing in?
There is a 60-day notice to either party to end the agreement.
Okay. Because you have the second resolution that we'll talk about with Brown that would start, you're still in negotiations with that one yet, correct?
Correct. Both of these, I believe, are in draft form as they're presented to you.
I just want to make sure I understand that the resolutions as we're approving make sense to anyone reading it, is all.
Well, I make the assumption that you will be able to gauge how quickly you're going to be up and running with the contract with Dr. Brown. And that will then allow you to give notice to the Veterinarian Association.
Correct, absolutely. The agreement officially begins July 1st, and both parties are on track to do that. Only if something should change would we proceed any differently.
Okay.
If I could just add real quick too, Member Daly, to answer the question. The Vets Association did come to us and said they were only interested in renewing the deputy administrator component. They were not interested in renewing at first the surgical piece of that contract. So they were putting us basically on notice that they were not going to do those services starting January 1. So we had asked them, can you help us out in the meantime while we implement this other solution? So I think they're aware that, it may not be a full 1 year term.
Okay. Yes, Chairman
I'm
Rand.
very excited to see this. This has been a long time coming. As a new board member, I was the one tasked by Chairman O'Neill to make the transfer of PAWS from the city to the county some years back. And as we structured that transfer, in the financial terms of spay, neuter, vaccination stuff, we've accrued a positive balance in our animal control accounts as a result of the contracts that we sell to other communities for animals. Nuisance services, I would describe them as, and secondarily for the fees associated with vaccination. It's been a positive thing for Peoria County, but what has been consistent over that period of time have been some of the challenges with working with the Veterinary Medical Association, who I should compliment for being our provider for as many years as they have. But their business model has become different too. They have different stressors on their organization. The question I had for Shauna or Scott was, did we not receive a grant to help construct or defray the cost of a surgical suite so that we could do this on site and not have to? And my office happens to be adjacent to the emergency animal clinic, so I see our PCAPS trucks over there every day dropping little furry critters off in the afternoon for their soon-to-be spay and neuter surgeries, and then picking them up in the morning and bringing them back to the shelter, where I guess we have to get in touch with the animal adopters and say they're ready. But I thought that we had secured some grant funds from, and I just want to say the state, some time back to help defray the cost of a surgical suite.
Yes, Chairman Rand. So Senator Kaler was gracious enough to place into the state capital bill $300,000 for construction of a surgical suite. That grant is being administered by DCEO, and along with every grant allocation in the state capital bill, and we have yet to receive notice, even though it's there and it may or may not have been appropriated. We've yet to receive our grant award notice from DCEO, so we know it's there. We just don't know the timing of when we're going to be able to access it. Just by way of quick comparison, same bucket of money was awarded for us for the reconstruction of our stretch of Lake Street and our stretch of Gale, and it was just earlier this year that we received the award notice on that grant. So there is money there. We just don't know when we're going to get it.
So does that impact a short-term decision then that's being done here to provide site facilities suitable to do the spay-neuter?
I think from our perspective, we've anticipated that those dollars are coming, but again, not knowing when. And so on the short term, and either Sean or Becky, please correct me if I'm misstating anything, but we'll continue with the Vets Association as they have been doing it, and then in the interim, until those dollars are actually awarded to us and we can design and construct such a surgical suite at the shelter on Northeast Perry, I think we're looking to take advantage and use Dr. Brown's facilities.
Gotcha. Okay. So there could be some interim transportation then involved.
That is correct.
Okay. Thank you. Congratulations.
We also, it's my understanding that we also have about, I think it was $250,000 that was put into the capital budget for 2023 to secure a mobile unit, should we need that starting July 1st.
Okay, are there other questions or comments about the first resolution? All right, if not, all those in favor, please say aye. Opposed? Motion is carried. Now we're on to the second resolution, and this one is to negotiate an agreement with Dr. Brown in terms of his eventually taking over these responsibilities in terms of deputy administrator of PCAPS, and also services for spay and neutering of animals. Do I have a motion for this resolution? Member Duncan, second. Member Ricker, thank you. Now, are there questions as it relates to this resolution? Betty?
In regards to Dr. Brown, his veterinary service, were there other veterinarians considered, or was because of his excellent service? Is this the reason we're using him?
Over the years, we continually, about quarterly, reach out to all of the veterinarians as they all fall under that Peoria County Veterinary Medical Association in asking who could help us think outside the box, who could take on extra surgeries, or really handle more of our workflow. And he is the only one that has stepped up to help us think outside the box in those regards.
Thank you, ma'am. What is the function of a deputy administrator?
Becky?
The state statute mandates a relationship with a veterinarian. There's not a lot else in there written. It's really, I believe, a way for the state to mandate that animal control is working with a veterinarian, mostly because we have such heavy rabies control influence in the community. And so releasing animals from quarantine has to be done by a veterinary administrator. Rabies vaccines of animals has to be done by a veterinarian. Releasing animals from quarantine, rabies vaccinating animals. So having a relationship with a veterinarian is really imperative to what we do. So I believe that the state is going after making sure you have that relationship in one way or another.
Thank you.
Yeah, I would assume it's the equivalent of a medical director at a clinic or a hospital.
That's what I was wanting to title him, but I didn't want to mess with the ordinance as it's coming through today. But he is they are effectively functioning as a chief veterinary medical officer.
Right.
Correct.
Okay. Are there other questions or comments about the motion to negotiate an agreement with Dr. Justin Brown and the Brown Animal Hospital to provide veterinary services and deputy administrator responsibilities for PCAPs? Yes, Betty.
I have one other question in regards to the amount of $118,000, and you say it's estimated. Is there some other cost that is being considered?
There is not. The reason it's estimated is it goes in contract with the $118,000 is for 1 year from beginning July 1st of 2023 through then June 30th of 2024. And so should we change that start date, then we would probably prorate that amount to reflect that.
Okay, other questions or comments? All right, seeing none, all those in favor of the resolution, please say aye. Opposed? Motion is carried. Okay, under miscellaneous, Mr. Sorrell.
Thank you, Madam Chair. The all PCAPs all the time theme for today's meeting carries forward with a miscellaneous item that I'd like to get on the record over the last couple weeks, including as shortly as maybe 45 minutes to an hour ago. Some, but not all board members have received emails or phone calls from the Humane Society in relationship to a significant bequest that is pending. As is the case with every bequest, no matter the value of that bequest, Becky, upon receipt, works with the state's attorney's office to determine the proper legal course of action, because sometimes the decedent's final verbal wishes are not consistent with the legally binding will that they may have prepared. And we have to sort through that. Sometimes it's very easy, sometimes it's a little bit more complicated. But we have before us right now that Jenny is reviewing, and once she's had an opportunity to review it, we'll provide guidance to to Becky. We have a very large bequest from a community benefactor that recently passed away, and the Humane Society has made a very strong point of noticing that it should be going to them versus the county. We will do whatever legally we are able to do, whatever that may be, but that is yet to be determined. Furthermore, I'd like to bring to this committee's attention that at no point have representatives of the Humane Society contacted the county administrator's office to try and work through this issue. Instead, they've immediately escalated this issue to all of you. That's a little bit of a slap in the face, quite honestly, in the professional management model that this organization has deployed for over 40 years. And at the end of the day, we're still going to do whatever the state's attorney's office advises us to do, because we have a legally binding document in the decedent's will that we need to follow. If that means that we're able to ensure that the Humane Society receives that donation, then that's what will happen. But if we legally need to be the ones that take receipt of that check, then that's what's going to happen. We'll work through that. The tactics that the Humane Society have used here, quite honestly, have worked to erode the 40-plus year relationship that the city, the county, and the Humane Society have had, which is a model unlike any other. And in most communities, even as close as Sangamon County, the animal control function and the Humane Society function at the local level are routinely at odds with each other. That's not the case here in Peoria County, hasn't been for over 40 years, and it's always been my goal that we continue to build on and foster that 40-plus-year-old relationship. Just makes it a little bit more challenging when the Humane Society is using the tactics that they're currently deploying. And I just wanted to make sure that the committee was made aware of that, and that we are being transparent with what we are doing. Because at no point have we communicated nor inferred that the Humane Society was going to be denied outright the contribution from the decedent. We are merely investigating, and then we'll follow what the proper legal steps are.
Scott, therefore, should we in any way respond to that email?
I would say that it'd be most advisable to allow administration to respond on your behalf, and we'll obviously send a communication to the entire board so that those that are not on this committee or not here today that are on this committee know the full story, so that we're completely transparent. But I would say the best course of action, Ms. Duncan, is to have the administration respond on behalf of the board.
Thank you.
Chairman Rand.
Thank you. Again, my experience in transitioning the city function over to the county function comes into play here. Pause is a loose term that is generally refers to our shelter operations, which are performed by the Peoria Humane Society. We specifically, when we created our department, if you will, titled it PCAPS, Peoria County Animal Protection Services, to make a distinction between animal control, which just sounded so harsh, and our new obligations as, the carer of doggies and puppies and kitties and cats. I have heard through the years people refer to our PCAPS function as PAWS, but we deliberately let them keep that moniker and created our own back in 2010 or 2009 when we were working on this. So I understand the confusion because it has existed since day one. I don't know, Scott, if the back of our trucks are labeled in any way with PAWS, but I'm thinking pretty sure it says PCAPS on there because I get giddy every time I see the moniker. So I offer that to our state's attorney's office as a little bit of history as to where this confusion comes from. I make no opinion, because it's not for me to make, on where the funds are to go to. But I would think a bequest from an estate has a duty to make sure that whatever name they're putting in a document, in fact, is the name of the end of the line for the bequest. So while that could have been, I'll just leave that alone. But just to reference where we have been over the many years as the sponsor of PCAPS, and something that we do very well, and create a little surplus from operations every year and put it in a little account for its future needs. The label pause has always been held on to by the shelter and animal welfare organization, Peoria Humane Society.
Are there other comments? Well, I would just say I have talked to people who are involved with the Humane Society, and my impression is that they really have nothing but very complimentary things to say about all the things that are the processes that are executed there. They're very devoted to providing additional funding, and this may be some sort of misunderstanding, but I think they want nothing more than to have a really good and close relationship with PCAPS and with the county board as a partner who owns their own building and 1/3 of the land there, and provides funding for additional services that perhaps we can't fund. So, I think this will all work out hopefully very well. Okay, any other comments or questions? Okay, meeting is adjourned.